Hello, I want to take a moment to discuss the cervical wedge, what its function is, and how to properly use this instrument. If I were an orthodontist, the wedge would be my braces. Now braces, when a child or adult wear them, gently push in the direction of correction, and over time, this pressure will help remold and reshape the structure and the position of the teeth. Obviously, they don't change the shape of the tooth. However, they do help stretch ligaments and reshape the connective tissue that hold the teeth in place. The purpose and goal for the wedge is very similar to braces in this way. We are looking to reshape and remold your spine over time in order to get a proper, or at the very least, improved curve in your spine. For most people wearing braces, the length of time this process can take varies, but averages about 2 years. As a chiropractor, I deal with the same type of tissues. So it makes sense that in order to get to the desired results, the process takes approximately the same amount of time. The amount of time this takes and the degree of actual correction that is achieved will vary greatly depending on your age, the amount of degeneration, how long the misalignments have been there, how compliant the patient is using the wedge, among some other factors. Even if the amount of degeneration will not allow for total correction, it is critical that we get your spinal curve as good as it can to improve the longevity of your spine, nervous system, and therefore your life and health. Once we get the spinal curvature improved, our job will be the same as the orthodontist, who then puts the retainer on and keeps the structures where they're supposed to be. So over time, that becomes the new normal structure. This is the cervical wedge. As you can see, the wedge is clearly labeled on the front, demonstrating which side goes towards the shoulders. This wedge comes in 3 different sizes: small for shorter adults and children, medium, and large. On your next visit, we'll fit you for the size that works for you and discuss the exact contact point where the cervical orthotic is placed on your spine. This contact point is determined by looking at your x-rays and determining where the structural challenges begin in your spine. You'll need to lay on the wedge 1 to 2 times per day. Daily gets the best results. I recommend at least 4 times per week as a minimum. When using the wedge, you'll need to find a firm surface, comfortable but firm, where you can lay down with your legs straight out. When laying on the wedge, your head will come close to touching the floor. It should come close to or just touch the floor while providing a stretch. If you get to the point where it seems very easy, like nothing is happening, let me know and we may have to fit you with a larger orthotic. When using a spinal orthotic, the evening works best. However, consistency is most important. So if the evening doesn't work for you, it is more important that you find a time that does work and then stick to that. Most people set a timer next to them to wake them in case they doze off. Falling asleep on it can cause significant discomfort, so avoid that if at all possible. You'll be given a handout where you can chart your progress time. The times listed on that chart are set as goals. You'll be asked to write down the date that you're using the orthotic and the actual duration of that time that you are on the orthotic. Remember, these are target times. You may take longer to reach a goal time. The more challenges you have in your spine, the longer it may take for you to get to the goal of 15 or 20 minutes. Use the times as guidelines, but really let comfort be your guide. I expect that there will be some discomfort afterwards, especially at the beginning. Remember, we are remolding tissues that have been in an unhealthy condition for often years or even decades. So just like when an orthodontist will adjust the braces, there can be some discomfort. If you experience what you consider more discomfort than expected, discontinue use and either call me or you can discuss this with me on your next adjustment. There is almost always a solution to get past this and we'll find something that works for you. Thank you for trusting in us and choosing us to be your chiropractor. I look forward to seeing you soon.